As plastic pollution is increasing in our oceans, our food supply, even in our own bodies, we're all being encouraged to reduce the amount of plastic waste we create and recycle whenever possible.
Yeah, one major source of plastic waste is hospitals. But recycling items in a hospital is not as simple as just remembering to put them in a bin. Our Dr. Frank McGeorge is here with a closer look at one local hospital and health system dedicated to helping find a solution. Hey there, doctor.
Hey, Karen and Amand. Yeah, you know, as a doctor, it's something that I see constantly. Single-use plastic, it's everywhere in a hospital. It's cheap, it's durable, and it helps ensure that items that come in contact with patients are sterile. But it is also incredibly wasteful.
U.S. healthcare systems generate 5.9 million tons of waste per year. About 25% of that is plastic. The vast majority is not recycled.
There's a lot of trash that's generated on a daily basis.
We've seen the news. We know climate change is an issue. Our mission here is to do no harm.
It's a big problem.
Tony Denton is the Chief Environmental, Social, and Governance Officer for University of Michigan Health. He says 35% of a hospital's plastic waste comes from the operating room.
A number of the items that are used in the OR, different types of plastics, different types of packaging, are all based on some kind of plastic element.
To try and reduce that waste, U of M Health launched a recycling pilot program at C.S. Mott Children's Hospital and the Von Voigtlander Women's Hospital. An OR team at Mott showed us how it works. The staff has been trained to identify which items can be recycled, including the blue wrap, plastic packaging, pans, gowns, and shoe covers. Those go in the purple bag. Items that can't be recycled go in the clear bag. Any items contaminated with blood or other fluids can't be recycled, but most of the plastic in the OR is not contaminated. While some changes are hard to make, this one was wholeheartedly embraced.
The staff is passionate. They see it on a day-to-day basis, how much waste is generated. They want to be part of the solution.
When you see the two bags side by side, the impact is obvious.
It's actually quite astonishing. I think it was eye-opening for a lot of our staff, the amount that we now can recycle, and they've made the process very easy, so it doesn't really add any additional time or effort.
U of M's 6-month pilot program collected 2.64 tons of medical plastic, all of which would previously have ended up in a landfill. The reaction?
Fantastic. It's a go blue moment because we're doing something that is meaningful.
Miracles happen here every day. We do a lot of things, a lot of wonderful things, but we also know that it's a very waste-intensive environment. So whatever we can do to divert plastics in particular from the landfill, I think we're excited about.
They stress recycling OR plastic doesn't change anything when it comes to patient care.
And in fact, I think down the road, outside of the four walls of the hospital, we're actually improving the health of the community that we serve.
U of M launched a permanent recycling program in the pilot hospitals this week and plans to expand it to other parts of the health system in phases.
I expect it to inspire other hospitals. We participated in an organization called Practice Green Health, which has 1,100 or so organizations in healthcare, all committed to environmental sustainability. One of our commitments to each other is to share lessons, best practices, so that we can accelerate learning and doing.
The take-home lesson?
We all have a responsibility as a community to do whatever we can. There's way too much going on with extreme weather events. So whatever we can do, we should do to sustain our planet for current and future generations.
Now, this is actually just one component of U of M's effort toward environmental sustainability and carbon neutrality. Other commitments include reducing greenhouse gas emissions, energy conservation projects, and creating a university culture of sustainability.
Obviously, you know, they've got a good intention, so why is it such a challenge to recycle this plastic?
Well, you know, believe it or not, it's actually finding a partner to take it. These items, actually, they can't just be sent to a local recycling center, and it doesn't help to collect the plastic if it can't be effectively recycled. Now, hopefully, though, University of Michigan's success on this front is also ultimately going to be a model that others can learn from. So they're pioneering.
Cool. Yeah, I like that. All right. Thank you, Doc.